All right, good morning, everyone. Thank you very much for joining us today for our session. I'm very excited to be able to present and introduce our presenter today, Dr. Shonda Kraft. Uh, she is coming to us here to be able to share with us on the topic of youth and mental health. She is a dean at the School of Health and Human Services, St. Cloud State University, and has been with us for about 6 to 8 years now, working for the state of Minnesota, helping shift the way that we view mental health and try to craft more effective ways of serving the communities in Minnesota. I appreciate your all of you joining today, and we will have time to hear from Dr. Kraft, and then as long as there's time at the end, we will have a brief Q&A that I will be able to filter. So as you see, my name is lighting up as EAP Consultants. Please, if you'd like, share questions with me, and I will funnel them over to Dr. Kraft for her to answer and share as we go here. So thank you very much. I'm going to hand it over to Dr. Kraft now. And you can share, yes, and Dr. Kraft, you can share your presentation when you are ready. Thank you very much. As we prepare on the technical side here, I'm going to go through and I will mute all of the microphones here, but I will ask that you keep an eye on those microphones, that you keep those muted as much as possible until there is a Q&A if we were to have you unmute. Otherwise, any questions or comments you can definitely put into the chat. I'll be monitoring them on my side to make sure that you are able to have your questions answered or discussed as we move forward. Looks like we're also having quite a bit of audio issues here. Let me see what I can do to fix that. All right, still working on some technical difficulties on the audio side of things. Give me a thumbs up if you have your monitor on and can hear me right now. Well, all right, looks like we got all the kinks on the technical side fixed on here. So let's get this show on the road. I'm so excited. My name is Stephen Reuter. I'm a Resolve EAP consultant here at the state of Minnesota. I'm very excited to be able to introduce our presenter, Dr. Shonda Kraft, who comes to us as the Dean at the School of Health and Human Services at St. Cloud State. I really appreciate her being able to make time for us to be able to share on this immensely important subject, to be able to discuss our youth, our mental health conditions here in the state, and what we can do to learn from one another. So please put any questions that you have in the chat. You can put them towards me. You'll see my name is EAP Consultants. I will filter those through, and time willing, at the end of the session here, we'll have a brief Q&A for us to share and chat and kind of pick Dr. Kraft's brain. At this time, though, I'd love to give it over to Dr. Kraft as long as she is available for the sharing button should be at the bottom of the screen, right next to your video button if you have a slide you'd like to share. Yes, and I see in here I'm getting some private messages. Just a quick housekeeping reminder as well to make sure that you keep your microphones muted. I'll go through routinely to make sure that all of them are off, but keep an eye on that on your side as well, as you are able to control whether you're muted or not as we go through. If you want your cameras on, that is something that you're definitely able to do, but at this time we'll keep those microphones off.
Well, thank you, everybody. Now that I am hearing appropriately all the audio, thank you so much for being here this afternoon. I'm really excited to see how many people we have attending this webinar, and hopefully what I'm going to present
Dr. Kraft, it looks like we're having some audio technicalities here. I'm not sure if, is there another input for your microphone that may be necessary? If you clicked on the down arrow next to
is everyone able to hear me now?
You can click there and see different microphone options.
Can people hear me now?
Yes, that's much better.
There we go.
Yes,
Okay.
we can hear you.
Okay, perfect. Thank you. So thank you, everybody, for attending this afternoon. I'm really excited to see as many people who are here on the webinar as we have this afternoon. And hopefully what I'm going to present to you will be of value. Obviously, what's maybe most important to me is the Q&A session that will happen towards the latter half today, because I really do value the opportunity to answer questions and engage in dialogue with folks. So I'm going to go ahead and get started with the presentation portion, which should be just about 25 minutes or so, I think, given our timing currently. Please let me know if you are unable to see. I'm going to just try that one more time. Okay. And hopefully everyone is seeing the slides.
I can see it.
All right, perfect. Thank you. All right, and hopefully you're not seeing like a major slide. Hopefully you're just seeing the slideshow and not all of my slide content, but we'll go ahead and get started. The topic today is social disconnection and youth mental health and well-being. And I, again, really appreciate being invited by MMB to provide this webinar with you all, given that February is Youth Mental Health Month for awareness purposes. And so I just wanted to start off with a couple of simple definitions, just to kind of distinguish between mental health and mental illness. One of the things that I find as a therapist and certainly as an educator and just a parent and a citizen is that oftentimes we kind of blur the lines between mental health and mental illness. And sometimes we say mental health when we really mean mental illness. We know for some people saying mental illness doesn't feel comfortable for them. It's not a topic or a term that they feel is really useful in their lives. And so I do just want to distinguish from a professional standpoint what these two words actually are. So mental health is really kind of a broad umbrella term. It includes our emotional, our psychological, and our social well-being. And really what mental health is all of the things that impact us cognitively, emotionally, physically. It's how we think, it's how we feel, how we act, and it can also determine how we handle things that come up in our lives day to day or big major events. So how we overall handle stress, how we relate to other people, and how we make choices in our lives that impact our health. When we talk about mental illness is really a very specific medical terminology. These are conditions that affect your mental health, right? These are conditions that affect the way you think, the way you feel, the way you act towards others, your mood, your behavior. And, some examples that we're maybe commonly familiar with are depression, anxiety, bipolar disorder, schizophrenia. We know that with mental illnesses, sometimes they have a very short duration. It can be more acute, kind of in the moment something happens and someone develops symptoms of depression or they're showing symptoms of anxiety. Sometimes mental illnesses, though, can actually be more long lasting and more enduring over a period of a person's life or even throughout the extension of their life. So I just wanted to start with a couple of definitions as we begin today. So as I started to approach this topic today, I thought about what's the best way to really talk about the current state of well-being for youth. And obviously, there are lots of different sources that could be utilized. If you put in a Google search, you're going to come up with all kinds of news articles and web pages and blogs and surveys and statistics, and oftentimes on the national level. What I thought was really important, given the fact that we have an audience of Minnesota state employees here today, was to really focus on data that was specific to Minnesota youth. And so one of my favorite go-to places for data is the Minnesota Student Survey. This was actually developed in 1989, and it is meant to monitor risk and protective behaviors amongst students. The grade levels of the students who have been surveyed have changed a bit over time, and they've adjusted. The current survey is being administered to students who are in 5th grade, 8th grade, 9th grade, and 11th grade. And so the data that I'm going to be presenting today across the different topics are going to focus on the results from this particular survey. And this is available through the Minnesota Department of Education website as well. So if we have any MDE folks here, big shout out to all the great work that you're doing. And again, really appreciate this data set and just the richness that it brings. All right, so the first thing that I wanted to start off with is thinking about worrying, right? We've been through a lot of things here in our state on the national level, the broader global level, that certainly bring worry and concern into the lives of our youth on a regular basis. Whether it is school violence, community violence, being aware of global warming, being aware of issues within the home or in the community. We know that youth in our lives today have a lot of things that are really weighing heavily on their mind. And so this question that is on the survey, I'm not quite sure, there's a request coming through, sorry. There's a couple of questions on the survey around worrying and anxiety. I chose to pull out the worrying question specifically at this first part of the presentation. And so you'll see two slides here. I've divided these up between the answers from 5th graders and 8th graders, and then the answers between 9th graders and 11th graders, just so that you can kind of see the progression of where these results sit. So the question that's asked to 5th graders is, thinking back the last 30 days, how much do you agree or disagree? I worry a lot. And what we see from 5th graders that answered this survey, and again, these are results from a 2022's survey, we see that really about 40% of our 5th graders are saying that they agree or strongly agree with the fact that they worry a lot in the last month. When we look at 8th graders, 9th graders, and 11th graders, the question is a little bit differently worded. So the question that goes to 8th graders, 9th graders, and 11th graders is, over the past 2 weeks, how often have you been bothered or not been able to stop or control worrying? So for 8th graders, they noted that really about more than half of the days, or nearly half of the days, is about 22%. Okay, so our 8th graders aren't worrying as much as our 5th graders, but definitely still a pretty decent amount of them who are engaging in some worrying behavior that they felt like was uncontrolled in the last 2 weeks during that survey period. When we look specifically at, it looks like somebody is trying to annotate this, and so give me just a moment. I'm going to have to stop sharing and try to share again. There we go. Okay, hopefully you're all still seeing this. Okay. 9th graders and 11th graders. Over the past 2 weeks, again, how often have you been bothered by not being able to stop or control worrying? For the 9th graders, again, right around 24, 25%. For the 11th graders, around 27%, right? So what we're seeing is that about a quarter of our students overall from grades 5 to 11 are experiencing what they would consider to be an excessive amount of worrying that they can't control, worrying that they can't stop, or just overall having a sense of like there are things that are going on that they're fearing, that they're worried about. So, what do we know about worry, fear, and anxiety? Well, we all worry, right? Worry is a regular emotional state of being for us as humans. And so, occasional worry or fear is really very typical for us across a variety of situations. We're worried, are we going to get to work on time? We're worried, are we going to pass the test at school that day? We're worried about, will my friends still talk to me on the playground, right? Like we're worried about these things. When worry and fear become more prolonged, though, right? When it's not just worrying about a specific situation or a person, or you feel like that worry is really taking over your life, then what we know is that there's a significant impact in multiple areas of our life. And it could actually be more of a symptom of generalized anxiety disorder. So I want to talk through a little bit about anxiety disorders because as a society, as a community, we tend to say we're anxious about things or I have anxiety rather than maybe saying I'm worried or I'm fearful. And again, when we go back to that definition that I presented at the beginning with that distinction between mental health and mental illness, right? This is where worry kind of transitions into something that may be more disordered. And so with anxiety disorders, and particularly generalized anxiety disorder, what we see is that persistence of worry and fear that's kind of pervasive throughout our life results in people feeling restless, irritable, they're on edge. It's kind of like they're always looking over their shoulder, or they're expressing that there's, dread or concern. They have problems with concentrating, right? So let's think about our kids. Yes, they may be really worried about a test that day in school, or they may be worried about an interaction that they're going to have in the hallway at their locker or something like that. But when it takes over their minds to the point that they can't concentrate, they may not actually be doing homework. They may not feel like they can even go to school, right? Because they can't focus enough. Or when they are in school, we might start seeing some acting out behaviors, or maybe they're just not finishing their tests, or they're not carrying through on performing on some task. They have difficulty controlling those feelings. And what we'll see as parents and adults at home or with, our grandkids or our nieces or nephews, is that sometimes sleep issues show up. And very significant sleep issues with kids. So for kids who have generalized anxiety disorder, those worries don't just turn off when they go to bed. Sometimes that is when they show up the most, right? Because they're thinking about all the things that happened that day, and they're starting to kind of predict all of the things that might happen the next day, and everything just feels so big, and they just can't settle their minds and their bodies down enough to really fall asleep or stay asleep. So we also know that when that generalized anxiety disorder shows up, that it can be very difficult for kids to potentially verbalize what's going on for them or for other people to understand what's happening, right? And sometimes in the midst of a situation that a kid is really uncomfortable with, they may actually engage in what is known as a panic attack, which can be indicative of panic disorder. And so panic disorder is the sudden onset of really intense fear. And it's oftentimes triggered by something. Maybe your child is normally really happy and excited to go to school, or they really look forward to the sports team that they play on, or some community activity that they engage in, but suddenly they're not wanting to go, or they get there and they freeze up on the field, or they freeze up on the stage, or their mind just completely goes blank when they're taking the test. That could actually be a panic attack that they're having in that moment. And again, when things become more pervasive, we might hear things like kids saying their heart's beating so fast. They feel like their heart's going to come out of their chest. They're sweating, they're trembling, they're shaking, they're crying, they're huffing and heaving, and they're just having trouble catching their breath. And they may just have this impending sense of doom, like something really terrible is going to happen if I go to school today, or something really horrible is going to happen if I can't perform with this activity that I'm doing. And it's all of these physiological symptoms that then start pairing with all the thoughts that are going on with in their head, and they really feel paralyzed in that moment. And if that continues to happen from time to time, again, if it's not a specific social situation, it could actually be indicative of a panic disorder if those panic attacks are happening on a pretty regular basis. Um, so thinking about how can you help, right? And I know there's a lot of people on this call, 400, 450 or something like that. You may all have varying levels of engagement with youth in your life, right? We probably have a lot of parents on this call. We have nieces and nephews in our lives. We have grandchildren in our lives. Maybe it's somebody that we work with in a youth group or a youth organization. Maybe it's somebody who's working, we just maybe got their first job, or something like that. And so if you recognize that someone is anxious in your life, how can you help them? One of the first things is to just help them to acknowledge that what they're experiencing is real. Acknowledging and affirming that that worry and that fear is real. It is present for them. It's not about saying, well, from the outside, I think everything is fine. You can get up and go to school today. Nothing's going to happen, or it doesn't matter how you perform today in the game. Just get out there and have a good time, right? Like, we don't want to say things that could potentially invalidate the feeling or the experience for the child. Again, especially if they're having panic disorder, generalized anxiety disorder. It's really important for us to be supportive, and also set boundaries, right? If we notice that they are avoiding certain topics, if we notice that they aren't talking to us, it can be important to say, I can understand. It looks like you're really worried about something, right? You're really, really anxious. And I want to acknowledge that. And it's important that you don't shut down, right? Don't shut me out. Don't just sit in your room. Don't avoid the school situation, or don't avoid going to the game. Set those boundaries to say, okay, we're going to figure out how can we get you back, into participating in that activity, or get you feeling more confident about going back to school, rather than avoiding, right? Because avoiding just feeds more into the anxiety. Um, if you're near somebody and they're having a panic attack, and this isn't just for kids, right? This is for adults, because we get them too. If you're around somebody who's having a panic attack, try to help the person stay as calm as possible and ask them how you can be helpful, right? Be really compassionate. Help them get some help, if they need it. Show that compassion. Stay with them in the moment. Let them know, hey, I'm here for you. I'm going to help you get through this. It's really important, again, to, as adults, our inclination sometimes to say, don't worry about it, right? Everything's going to be okay. But again, those words to somebody who's in the midst of having a panic attack or who really truly is really anxious is not helpful. And so, again, just everything that you can do to be present with that person, acknowledge their experience, ask how you can be helpful to them, and help them get that help is really the best way to handle panic attacks and other types of anxiety disorders. And we'll talk a little bit about getting professional help towards the end of the discussion. So I want to move to depression. And this is another one of those areas where we hear depression being talked about pretty pervasively in our society, right? I'm depressed. This is depression. I think this is depression. Again, remembering that depression is a specific clinical disorder, which we'll discuss in a little bit. But looking at how are our kids doing, right? How are our kids doing with feelings of sadness and feelings of depression? Again, there's differentiated questions on the survey that's administered. Fifth graders are asked a question, thinking back to the last 30 days, how much do you agree or disagree with the statement, I sometimes feel sad without knowing why? Okay. And what we see there is about 47% of fifth graders agree or strongly agree with that statement. The eighth graders, ninth graders, and 11th graders all get the same question, which is in the past 2 weeks, how often have you been bothered by feeling down, depressed, or hopeless? Okay. And if we look at several days on down, right, we're really seeing that about 45% of our eighth graders are endorsing that at some level in the last 2 weeks, they've felt down, depressed, or hopeless. When we look at our ninth graders on that question, we see that rise just slightly to 48% of ninth graders saying that they're feeling down, depressed, or hopeless. And when we get to 11th grade, that's gone up to nearly 55% of 11th graders saying that they've had feelings of being down, depressed, or hopeless just in the last 2 weeks. So again, depression is a very specific disordered definition, right? There are multiple types of depression that a youth may experience in their lives. And we know that that depression can actually show up in very young children, as well as in teenagers as they're heading into later adolescence and early adulthood. So some of the types of depression that may affect youth in particular, there could be a diagnosis of major depression. And this includes symptoms of depression, which last for at least 2 weeks. And they typically interfere with a lot of different places in your life: work, school, sleeping, eating, being around other people, engaging in activities. And again, it's in at least 2 weeks of your life and across multiple sectors of your life. Sometimes people may actually be diagnosed with persistent depressive disorder, which is formally called dysthymia in the Diagnostic Statistics Manual. But this is lesser symptoms, lesser severe symptoms of depression. And typically people who have those symptoms for at least 2 years in duration, right? So major depressive disorder does not necessarily last all ways into your life, right? Sometimes people have just short episodes where they have a lot of symptoms and very severe symptoms. Sometimes people have less severe symptoms, but they're much more pervasive into their lives. And in particular, a type of depression that's diagnosed in youth, which is actually a fairly new definition, is disruptive mood dysregulation disorder. Very long title, DMDD. And this is where children or adolescents have persistent irritability, anger, frequent outbursts of anger, intense temper tantrums, They're pretty moody as well. One day they may really love you, the next day they hate you and they can't stand you and they're slamming doors and they're acting out and they're just irritable. But they oftentimes have very severe symptoms and they can potentially provide a lot of problems for them at school and at home, as well as in their peer relationships. They just kind of push everybody away, or people are less likely to want to be around them just because of those outbursts and the dysregulation that they may display. So again, depression in general is that you're looking for symptoms that occur consistently throughout the day, nearly every day for at least 2 weeks, right? So if we go back to that major depressive disorder, that is kind of the benchmark, if you will, for depression. And so what do, right? Like as a parent, again, as an adult in the life of a youth, what happens if you think that somebody in your life, a young child or an adolescent, is depressed? You're not a therapist. You're not really sure if this is something you want to go to therapy for. Maybe that's not something you believe in. It's not something the kid's interested in. Even as a therapist, I kind of do a quick little survey just in my mind when I'm paying attention to symptoms that I might be seeing in my own kids, or even when I'm seeing clients for the first time with that kind of formal diagnosis. And I came up with an acronym of DEPRESS. And this really represents all of the typical symptoms that you would see when somebody is experiencing depression. So are they feeling down? What is their energy level? What's their level of around pleasure and doing different activities? How restless are they? What are their eating habits look like? What are their sleeping habits looking like? And what are their safety habits looking like, right? Those behaviors, are they able to keep themselves safe? If these symptoms, the majority of these symptoms are present, and they're very severe and they're persisting over at least 2 weeks, it really is important to contact a medical professional or a mental health professional. Your pediatrician or your primary care provider is a great place to start. Most medical professionals now will do a brief screening for depression and anxiety in the doctor's office at regular appointments. So that's a great place to start if you're not quite ready to get your kid to therapy or even think that that's the place you need to start. But it is also important that when you do go consult that professional, that you do follow up on their advice, because again, with some of these symptoms, the severity of them, it can very easily progress to something where there's an unsafe situation for the child, and you're feeling very, very disconnected and not knowing how to help them because they're isolating themselves in that depression. And keeping an eye on our time here, I think we're doing well. So the last place that I wanted to look at with the presentation today is around social connectedness with peers and adults. Social connectedness, broadly speaking, is just how well do we feel that we are engaged with others, that people care about us, that we're known to other people, that we have a network with peers, with adults, with family members, and with our community. And there are actually several questions in this survey that I really, really like, but I picked this one just for brevity of our time today. And so the question here that does actually span across all 4 grade levels is, when you spend time doing activities outside of the regular school day, how often do you develop trusting relationships with peers your age? And so what we see in 5th graders is that about 40%, a little over 40%, say that they sometimes, rarely, or never develop trusting relationships with their peers. 8th graders, it's about 27, 26%, so fairly lower than 5th graders. But again, a significant number of them saying that they don't really have trusting relationships with peers. When we look at 9th graders, the numbers stay pretty similar. It's about 36%. Same thing with 11th graders, about 34%, right? So what we see again across these 4 different grade levels is that generally about a third of our youth are saying they don't really feel they have trusted relationships with peers. They don't really feel connected with their peers. And so what we know is that our social lives are a really important aspect of our mental health. And we know that for adolescents in particular, forming relationships can be pretty fraught. There's a lot of development that's going on around identities. And we know certainly from a lot of research that identity development starts at very young ages. When people are starting to figure out who am I in the world, who is important to me, where do I feel like I fit in? And so even, looking back, 3rd grade, 4th grade, 5th grade, those pieces of identity development are really important. There are a couple of pieces with social relationships that I think is important to pay attention to. I certainly see a lot of this in my therapy practice with youth as well as younger adults. And it's the ideas of social awkwardness and then social anxiety disorder. So social awkwardness is just that general feeling that like, I just don't feel comfortable in social spaces. I don't know how to read people. I don't always feel comfortable around people. I'm not quite sure how they're going to take me. Like, I just want to kind of avoid things. And they can sometimes feel really left out. So that's like the mental health component. The mental illness component is social anxiety disorder. So when people have repeated experiences of social awkwardness, where they're repeatedly feeling like they're left out by others, or they just don't fit in, that can actually develop into a social anxiety disorder. And with this, we oftentimes see an intense, very persistent feeling that you're going to be judged by others, that you really don't belong in those spaces because there's something inherently wrong with you. You are a flawed person. You can't fit in with other people. People don't understand you. You can't trust them. And it's across multiple types of social situations. So this could start as simply as like, I just don't want to meet new people, right? Like I've got my little group of friends. I'm not really interested, or I don't really need friends. I'm good by myself, right? They may not want to answer questions in class, right? Because they're afraid of being judged. But then it can also be more pervasive, right? They may not want to use the bathroom at school. They may not want to use a drinking fountain at school. They may not want to eat in front of other people because there's just these overwhelming feelings of being humiliated, judged, or rejected by their peers. Um, we know that, again, teens who feel really awkward and actually have social anxiety disorder oftentimes are experiencing feelings of loneliness and isolation. Loneliness isn't just about who you don't have in your life, right? It is that state of mind where we feel empty, unwanted, misunderstood, not included. Even when there are lots of people around, we kind of just, those feelings of loneliness just say, I don't belong here and no one wants me here. We know that as people experience more loneliness, more social isolation, again, we see the same kind of things happening: sleep issues, less physical activity, alcohol and tobacco use, as well as increased chances of developing other types of anxiety and depression. So, what can you do if you see a child in your life who's just like not connected to other people? They don't trust them, they're not around them, they don't feel like people care about them, they're avoiding them, they're isolating themselves from their peers. First and foremost, normalize that, acknowledge it, say yes. It can be awkward to meet new people. It can be awkward to be the tallest kid in your class right now. It can be really awkward to not know, like, that TV show that everybody's talking about, or that you don't use social media and so you're not included in these things. Like, acknowledge that it's awkward. for the kids and the adolescents in your life, and really build some self-compassion. Help them to understand the places where they are special and where they are doing things that are really cool and important, and the people who do care about them. It's also really important for us to model healthy and positive communication, especially when we start to initially see that our kids maybe are truly being left out or they don't feel included. Again, our inclination can be, well, I'm going to go and talk to that teacher and tell them to not have those kids, blah, 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 right? Like, we have to model, that positive communication. Be curious, understand what the issue is, try to figure out what the problem is, ask if they actually want you to help them solve it. And when you are helping to solve and support, being very mature in your responses as well. Listening is always important with our youth. Listening to understand is even more important. It's not just about, do you hear them? And so that you can see what the problem is, it's actually understanding their experience. Don't minimize their experience. Don't just say again, oh, I'm sure that's just kids being kids, or, oh, they've always been that way. Really try to understand what the experience is from their perspective. And then again, if you're seeing that social isolation and that avoidance of activities, avoidance of school, seeking some professional help, talk to a medical professional, talk to a mental health professional so that they can help with some of those symptoms. The last thing I want to touch on is adult social connectedness. So the same question that was asked before, but about adults, trusting relationships with adults. And so what we see in fifth graders is about 46% of fifth graders say they don't have a trusting relationship with an adult, or that they only sometimes feel that they do. About 48% of eighth graders say that they either don't have trusted relationships with adults, or only sometimes feel like that they do. Numbers again look very similar with eighth graders and with ninth graders and 11th graders. Again, right around that 45 to 48% mark. So even more important than having trusted relationships with peers is our youth having trusted relationships with us as adults. And what this is saying is that just a little under half of kids across these age spectrums, these grade spectrums, don't feel they have trusted relationships with adults. Sometimes we as adults have done things that have been problematic. We've said something, done something that's really hurt someone in our life. And we need to figure out how to fix that disconnect, how to repair that relationship. When we have made a mistake, it is really important for us to make sure that we acknowledge that mistake, right? Recognize that we may have hurt our kids or someone in our life. We may have offended them. We may have made them feel unvalued, or we may have made them feel invalidated with their experience. But we know that for us as adults, just like with kids, sometimes an apology goes a long way to help us be able to start forgiving and begin healing and repairing those relationships and rebuilding that trust. So what is a meaningful apology? If you think you've done something and that just your child or a child in your life, an adolescent in your life, is just feeling very offended by or affronted, acknowledge that you did something wrong, said something wrong. Take responsibility for your own actions. Be really honest about what you did, why you did what you said. Don't avoid the other person's feelings. Again, saying that I'm sorry that you feel X puts that on them, right? You're kind of telling them what you think that they're feeling. You want to ask them how what you did or said, or what that other person did or said, really impacted them. And then just be really curious and open to that repair, trying to figure out, okay, what could we do to make it better? I'm really sorry that when you said this happened to you at school, that I just brushed it off, or I didn't believe you. So in general, how can we support youth, right? Social support is really, really important. When we talk about that social connectedness, it really is about the network of peers, adults, friends, and community members that are in our lives. We know that mental health and mental well-being are significantly impacted by the level of support that we feel like that we have. And for kids and for teens, it's even more important that they feel like that they kind of have people around them. It's important to really recognize that there are different types of support that youth in your life may need based on the stressor that they're experiencing. So there's informational support. That's where maybe they're coming to you for advice or for guidance. There's emotional support. They just need a hug. They just need you to be compassionate. They just need you to listen and to give them comfort and to promise them that you're always going to be there for them. There's esteem support, right? It's that I know you got this. Like, I believe in you. You're helping to build that confidence for them with that situation that they're dealing with. Sometimes it's tangible support, right? Like sometimes they actually need some type of assistance. They need a place to go, a place to stay. They need you to, help connect them with a resource in the community, take them to the doctor, take them to a therapist. And sometimes it's network support, right? Just helping them to have that sense of belonging and that they belong somewhere, that there are people out there that care about them. And maybe it's just that you need to help them find their people. The last thing that I'll say is that, obviously the hustle and bustle of our days, sometimes we don't always have time to stop and listen, right? And even as adults, we might say this, oh, how are you doing, right? And sometimes in the back of our head, we're thinking, please just say okay or fine, because I don't really have time to engage in anything. Our kids can pick up on that, right? The youth in our life can pick up on that. So we don't always have the luxury of waiting for somebody to reach out and tell us that they need help, right? And so, in terms of promoting that self care with a child, or if you as a parent or an adult is going through something with a youth in your life and you're trying to support them, you need support. I talk about something called practicing grace. So, generating positive emotions for yourself and others. This isn't about saying everything is going to be fine, everything's going to be great. It's about saying the both and. Yes, things are really hard today. I understand that you're really depressed. We're going through this anxious period of your life. And here are some other things that are really great, things to look forward to. Reflect on your accomplishments and the accomplishments of that other person. Help your child or the youth in your life to be able to see where they are special. To see where they are really pushing through and persevering through things, even when life is hard. Ask for what you need, right? Encourage them to say, what do you need? From who? Why do you need it? When do you need it? Connecting with a trusted person, especially if you're going through something with your child, depression, anxiety, they're feeling isolated. You can feel isolated as a parent or that adult in their life because you're trying to fix and mend. You may need to also make sure that you're connecting with someone who you trust, who's giving you some good advice. And then take care of yourself, right? Same thing we want to tell our kids. Exercising, eating, and sleeping. Those are sometimes the first things to go, the first symptoms that we see that something is wrong. And so it really is important for us to pay attention to that, try to encourage that and support that as much as possible. And with that, I'm going to stop for Q&A. And I think we have somebody to moderate questions. So
Yeah.
thank you.
Thank you very much, Dr. Kraft. This has been enlightening to hear, and we already have a great list of questions. Everyone, if you have questions, please put them in the chat. I've been taking them and putting them into a list here so that we can hit a few of these as we go. At the beginning of the presentation, there were a couple questions, just data questions. Specific,
Yes.
you referenced protective behaviors, and they said, well, can you dig into and share a little bit more about what you meant by protective behaviors? And then also, that was around the time you initially shared the survey data
Yes.
and the results. So protective behaviors, if you could define that, and then also, what is the most up-to-date data batch there, whether that's 2022 or when that was recently updated?
Yeah, thank you. So that definition of the Minnesota Student Survey, that comes directly off the MDE website. And so their description of the Minnesota Student Survey says that the purpose is to monitor risk behaviors and protective behaviors. Outside of education, there's a lot of other places that talk about protective behaviors, including in the therapeutic world. Generally, protective behaviors are those those characteristics or the presence of certain behaviors or people that can help mitigate risk. So for example, when I was showing the slides around having a trusted relationship or a trusting relationship with a peer or an adult, having a relationship with at least one trusted adult in your life historically, time and time again throughout research, has shown to be a protective behavior to kids feeling lonely, isolated, left out, depressed, anxious. It is connected to drug and alcohol use. It's connected to early engagement in sexual activity. It's related to a lot of types of risk behaviors. So protective behaviors are really those things that we know that could exist within the life and the context of a person, that helps to really kind of provide a buffer against other things or other types of risk that may happen in their life. The data that I just showed was from the 2022 survey. And so that is available on the MDE website. And I can put that link in the chat. Oops, I think I can
Great.
find it. I closed all my windows
No, that's all right.
all my other documents so I could focus on just the presentation. But I will throw that in a chat as I'm listening to you with other questions.
Sure, I appreciate that. Thank you very much. There was also a question on the DMDD a confirmation. Did that replace the oppositional defiant disorder?
Correct. Yes.
It did. Okay. Yes. And then also we had a question regarding kind of an age cutoff, as DMDD does in a lot of ways reflect, I think a lot of young parents see this. They're 2 and 3 year olds, you'd say, kind of definition there. What is that cutoff, and how do they make that understanding where it's a child that's growing and developing normally, and then, oh, this is starting to get into that concerning area?
Yeah, yeah. So, really with all of these diagnoses, this isn't just like one tantrum, right? It's not just one episode of being angry or, really particularly defiant, right? It's a over a period of time. It's repeated episodes of those behaviors, and it's pervasive across wide swaths of your life, right? So maybe the kid is only acting out at school, but not at home. They're fine in the community, right? Or they're great at home, but they're acting out in school and other places. So really the best way to think about that diagnosis is truly to talk with a medical professional or a mental health professional. Like, you really do want to have that discussion with someone who has the appropriate training to be able to not only just pay attention to the signs and the symptoms, but that they can really understand the developmental trajectory. Generally, the DMDD diagnosis is given to youth between the ages of 6 to 10, and generally that child needs to have experienced the symptoms on a pretty regular basis for 12 or more months. So, certainly, could they be diagnosed after the age of 10, before the age of 6? Potentially, but that's really the diagnostic sweet spot for those symptoms. And again, the pervasiveness of at least a year.
Wonderful. Thank you very much. There was a question, or we have quite a few questions, but one that's come up quite a bit is, how do we find a therapist or a clinic for our child, since sometimes it just feels like it's like spinning a wheel and trying to find the right fit. Many of these child therapists also seem to move on quickly. So what are your recommendations?
Yeah, well, I mean, first and foremost, I would say definitely trying to find a therapist who actually is interested in working with children and adolescents, as maybe even something that they specialize in can be really important. I know that myself, as a licensed marriage and family therapist, I'm trained to work with individuals, couples, families, groups of all ages, right? And that's something that I'm actually very passionate about doing. I don't turn away anybody just because of their age. But not everybody operates that way. Some people do specialize. Sometimes people feel really uncomfortable working with kids. So a great place to start really is your pediatrician. Oftentimes they will have a list of providers that they trust. They're not always going to know who's in your insurance network. Sometimes you might not even want to be using insurance. You might want to be private pay. But I definitely would encourage people to start first and foremost with their pediatrician. When you're taking your child to those annual well child visits, That's a great time to talk about behaviors that you're seeing. Again, the American Medical Association really does ask that medical professionals are asking some of these questions, right? The PHQ-9, the GAD-7 for depression and anxiety, respectively. That tends to be part of those papers that you're filling out every time you take your child to the doctor. They're looking through there to see how you answer. And then certainly once kids get of age where they're answering those questionnaires themselves, then they're also able to, kind of look at the information coming from the child and from the parent. If you want to just do some research on your own, the website Psychology Today is another place that you can go to. You can look at therapists from across the state of Minnesota, and you can also pare down, by gender, what race or ethnicities do they work with, what languages do they work in. You can actually choose to look at therapists who work with children, with adolescents, or just with adults. So those would probably be the first two things that I would say.
Thank you. Excuse me. Thank you very much. Yeah, like I said, we had quite a few people interested in finding that resource to be able to connect with those therapists. We also had a question in here about advocating for your child's needs with their doctors and also in schools. So specifically, the question is, how would you approach a school where the student's classroom creates a significant anxiety, inability to concentrate, and there might not be the support that you're hoping for within the school system themselves?
Yeah, thank you. That's a really great question. And so I'll say three things. First of all, I think it is really important to have those conversations with the teacher, with a guidance counselor, with a principal, right? Whoever that person, that point person is for student classroom environment, student behavioral concerns. Some classes have a school counselor, or some schools have a school counselor or a social worker that you can also get connected with in particular. But really being able to demonstrate, again, what is it that's making the child uncomfortable in the classroom setting? Let them speak, right? First person report sometimes is just as important as you as a parent coming in and saying, this is what my child is saying, they're experiencing or is happening to them. Second thing I would say is that, again, talking to that medical professional or a mental health professional, because there may actually be a diagnosis that is present for your child, right? And sometimes, and it's very unfortunate, sometimes you need to have a piece of paper from somebody with some letters behind their name that says, this is actually something that's happening for this child. This isn't just they don't like the classroom or they're just being, defiant against the teacher. They really truly have social anxiety, or they have some other type of an anxiety disorder or depression that's making it difficult for them to be in the classroom. And then start getting connected with your special ed resources, right? You can make adjustments for children with the classroom setting. Special ed would handle particularly IEPs, so individualized educational plans that could allow the child to not be in the classroom or to have someone in the classroom with them to help them calm down. You may also be able to do kind of a non-special education 504 plan, which you kind of work directly with, again, that social worker, school counselor, teacher, principal, to try to create a more, conducive learning environment for the student. The last thing that I would say, and again, not the first place to start, but we in Minnesota are very fortunate to have resources for open enrollment and different types of school settings. And so I definitely think that if you have the opportunity to try to find a school setting that may fit better for your child, if you don't have those resources available in your school district, to avail yourself of those opportunities.
Wonderful. Thank you, Dr. Kraft. One final question, and looking at the time here. Final question that we'll use is distance learning. How do you find ways to navigate the distance learning supports, if there are any, and if there is any current data that is focused on distance learning as opposed to in-person learning?
Yeah, thank you for that. I had to intentionally not go into things with distance learning and social media, and I know there's so many places we could have gone with youth and social connectedness and things like that. I think particularly since, 2020, when, all of our children were forced into distance learning, and frankly, many of us adults were forced into distant working, we know that there's just starting to be some research coming out, right? Again, there's anecdotal research, there's blogs, there's surveys that have gotten thrown up, but I think that, waiting for some really specific research about the impact of distance learning on kids is going to be something that we're going to be seeing in the next couple of years. I think, again, anecdotally, we know that distance learning for many children was actually a positive experience, right? Kids who do have social anxiety, kids that do have depression, kids that do struggle with feeling that social awkwardness, they actually potentially did better with distance learning just because they weren't in those environments that were overly stimulating, or those environments where they were having those negative peer experiences. For others, that was just a complete change of everything, right? For many of the kids, right, the thing that you saw in that survey is that the majority of our kids do have trusted relationships with peers. And I could have gone into the relationships with teachers and others, and I mean, they were really great stats in there about our kids. And so when you really count on that social environment and it's really important to you as a kid, having that cut off can be really devastating. And so I think that we're going to see more research and the impacts of having those worlds just completely shifted and those social milieu changes in the coming years.
Thank you again, Dr. Kraft, for your time and your expertise. We have a list of questions that we sadly weren't able to get to, and we'll keep track of those, and I'll see if I can connect with all of you who had those questions to see if we can get you some sort of answer on those after the fact here. But thank you again, Dr. Kraft, for your time. Thank you, everyone, for attending, and everyone have a wonderful day, and we hope to see you and see the great work that you're doing, Dr. Kraft, show up in the work to come, days to come. Thank you.
Thank you, everybody. Have a great day.